All right, so day in the life in the dental office here. These ladies are hiding. They're running away really fast. Some of them are eating in the back room. This is how this goes back here. Looks like she's coming in right now. We're gonna just come on out. He has had hearing loss since he was in his early 20s. People can't breathe because there's not enough room, and with hearing issues. So it's a huge connection between these two, and I'm really glad we're able to talk with him about it today. On our new patient days, what we are doing is pretty much going from new patient to new patient, but these ladies are an incredible team. So when you're here in the dental office, you're typically here for about 90 minutes or so, an hour and a half, and you are going to be going through all sorts of diagnostics, photos and CT scan and all sorts of things, and these ladies really make it happen. But I just wanted to tell you, it's so crazy how every single time we do this, it seems to be a theme comes up for the day. And I've seen 4 patients this morning so far, and everybody's talking about the same thing, and I can't tell you how often this happens. So the theme that's coming up today is jaw joints. So many people are having jaw joint issues, and some of them have been really fascinating. We had a young man, he's 26 years old, and he's already wearing hearing aids. Well, how could that be related to dentistry? We have a young girl, I just saw her, she's also, I think, 25 or 26. She has so much fatigue that she says her friends don't invite her on hikes anymore because she has too much fatigue and they know that she can't go with them. Another young girl, I think in her mid-20s, is wearing her teeth off so much, she looks like an old man. She's wearing the teeth off so much. Why? What do all 3 of these people have in common? Well, I'm going to go over that in a minute, but I have to go see a few more new patients first. All right, I wanted to give you just a little bit of an insight to what a new patient appointment at Total Care Dental looks like. When you arrive here at our dental office, you're going to come into one of our new patient suites. And in this room, what we do is we have an interview with you where really what we've heard from a lot of people is they just want to be heard. Like you just want to share your story and you want somebody to actually listen to you. So that's what we do. We sit down and we listen to your story. And then we go through a very comprehensive new patient exam. They're already ready. I'm sneaking in here before the patient comes in. We go through a very comprehensive patient exam. We go through all of these different checkpoints. Looks like she's coming in right now. We're gonna just come on out. And we go through all these different checkpoints with the patient. We take a whole bunch of photos. So everybody's like, what are you taking photos for? Well, we use the photos for a lot of things. I'll show you where we're gonna take those. Right over here, we take a CT scan. We have an enormous, brand new, gorgeous CT scan machine. It takes a full skull. So when we're taking a scan of you, we're going to take the entire thing. You can see everything we get in that. Then we're going to take x-rays, traditional dental x-rays, the kind that go in your mouth that show us your teeth, because I can't actually see things like cavities on a CT scan. And then we take pictures in front of this chart. Why? Well, we look at a lot of things like posture. We look at the way your head sits. We look at the way your hips are positioned. Why in the world are we looking at all of that? Because it tells us a lot about the way you're breathing, about the way everything's working from an airway perspective. So we're going to do all of that. Then we have a hygienist come. She does an intraoral exam. We can go into one of our other suites. Looks like the patient's not coming in one of these. We have a lot of amenities ready for you here. So we have a blanket. We have a packet of things. There's a notepad in there for you to take notes during your appointment. We also have vitamin E, which is something that we use to counteract the radiation of any x-rays we take. And then I come in and I do a full exam. We look through everything. We talk through everything that you shared in your interview. I look through your CT scan, your x-rays, your photos, everything together. We actually do it with you just sitting right here at this desk. You sit here, we look at the computer together, we go through it all, and then we talk through a plan. And you know, one of the things that I'm famous for saying is I always tell everyone, my job is to tell you exactly what I see if it were my mouth. The things that I would want to know if this were my situation, my health, my mouth. And then it's up to you to let us know how we can help you. You're 100% in charge of everything that you're going to do. We just share with you everything that we recommend. On the back of what I call our care plan, so we have the front of the care plan that I fill out as we go through the exam. Guess that's not upside down. That's correct. I notate on here everything that's happening. And then there's also a lot of pictures and things that can describe it on the back. We give you lots of information so that when you go home and you forget everything we said, you can reference back. That's what a new patient appointment looks like here. So I just came out of another new patient appointment, and interestingly enough, of course, we talked about jaw, we talked about a few other things. But I want to tell you a couple of things that I do that are really interesting. So as soon as I walk out of a patient appointment, I pull out my little handy dandy cheat sheet. This is just my printed off schedule that I have for the day. And I come and I pull up a transcription service. And what I do is I literally just talk out my note for that patient from the day. What that does is it allows it all to be very fresh in my mind. So I just share their story. I share everything that they've shared with me, as well as recommendations, health implications, and all of the above. So those are things that I then do just immediately on a transcription, which allows me to give a lot of detailed notes to them. And then another fun thing I do is I come and I fill out a little note card, and this is going to go to the patient, and it's going to just say, welcome to our practice, and I'll usually put something very personal because I just remember it. It's right then. Then I look down the hallway and right here you can see there's these little flags on the side of the door, and if one of those green flags is sticking out, then I'm needed. If one of the red flags is sticking out, then the hygienist is needed. So we're going to look down the hallway together. I don't see any green flags right now. There's a red flag down there, but no green flags, which means I'm good for the moment, which is why I can talk to you for a minute. All right, so let me tell you a little bit about a couple of those jaw patients that I was talking about this morning. Kind of interesting. Let's talk about the gentleman who had hearing loss, first of all. How does hearing loss have anything to do with jaw joints? Well, it's interesting. When he was younger, he must have had crooked teeth. And so the orthodontist decided that they wanted to take out teeth on the top for him. Only the top, not the bottom, which is actually unusual. Usually if they're going to take teeth out, they're going to take out teeth on the top, they're going to take teeth at the bottom at the same time. They only took top ones out on him. What that does is create a little bit of a mismatch between the top jaw and the bottom jaw. So now the top jaw is narrower than it should be, and the bottom jaw is the same size as it should be. So when the top jaw is narrower, the bottom jaw has to fit inside of the top jaw, and that will push the bottom jaw back to fit a little bit further back so it can fit inside of this too small top jaw. The way the jaw works is that the bottom jaw has the jaw joint or the ball in the socket with it. This is all attached. So if this part gets pushed back to fit inside, you see how when I bite together like this, my bottom teeth fit inside of my top teeth. That's the way our teeth should be arranged. Well, his couldn't fit very well because they took out a tooth here and a tooth here on his top jaw, which made it narrower, and then the bottom jaw had to fit further back to fit inside of it because it's now smaller. That pushes the back end of it further back because this whole part is going back. Well, the back end of it is the ball in the socket. Well, look at where the jaw joint is. There's the ball, there's the ear. He has had hearing loss since he was in his early 20s, and he knew because he was always asking his girlfriend to repeat things for him. So when this jaw joint situated itself further back, what it did is caused a lot of pressure into the ear canal. He said he's always going like this, like opening his jaw to try to release the pressure. Makes all the sense in the world because it's too far back and it's pressurizing that canal. So he has to open and bring that ball of the jaw joint forward in order to depressurize it. So what do? We're actually going to most likely make the top jaw wider again so that the bottom jaw can come down and forward and depressurize this jaw joint. It's amazing how much effect we can have. He said he has tinnitus or ringing all the time. It's so loud in his ear. Why? Well, because of the pressurization that's going on back in that jaw joint. So what we're going to do is we're going to move that jaw joint, allow that jaw joint to come down and forward as we expand the top jaw and see if we can't resolve his hearing issues. He should not be having these. I asked if he had any genetic problems, anything like that, and he said no. So this is developmental or something that's developed because of what's gone on, most likely with the orthodontics. They were a little upset. They're like, oh, our orthodontist ruined us. I said, they didn't know any better. It's what they knew to do to straighten teeth easily. Unfortunately, we're seeing a lot of fallout with that now, with jaw joint issues, with airway issues, people can't breathe because there's not enough room, and with hearing issues. So it's a huge connection between these two, and I'm really glad we were able to talk with him about it today.